I'm definitely seeing people with medical problems who are coming back from Kumbh, but obviously in a place which has so many people and people are dipping in the water, they're taking dips in the water. I would expect that they would happen. The number of people who are coming with medical problems is much less as compared to the volumes of people that are going over there. That way, I think the control is very good. But yes, people are definitely coming with something like what we call as gastroenteritis, where they're having loose motions, vomitings and all that. They're having fever of unspecific or unspecified origin. Most probably there are viral fevers which are happening. Quite a few people are suffering from respiratory tract infections like a runny nose, sneezing, cough and cold, which is obviously very common when you go to such a crowded place and then you take a dip, which might be at 3 a.m. in the morning, which might be 4 a.m. in the morning. So you can get exposed to this cold environment over there, and these infections become very common. The other things which we are seeing is a lot of skin rashes on the body, which is again a dermatological problem which can happen when the water is not too clean and the skin is sensitive of different people. Obviously, then with so many people taking a bath and all that, and with such a crowded place, these type of bacteria like the coliforms and all that are common and can become rampant over there. But if the counts would have been that high, most of the people would have been suffering. See the volumes of people that are going there, but that number of people are not suffering. It's a few people who are suffering from these infections. So obviously, when such a large number is visiting, these type of things are possible, which obviously we should take care of. But obviously coliform bacteria would cause loose motions, vomiting, they would infect the intestines and all that, and cause mainly gastrointestinal symptoms. Yeah, that is what we should stress on, because whenever you are going to such a crowded place, one is, I think, see, water is always a problem, that you should carry a portable water or bottled water with you, because if you in such a crowded place which is so busy and all that, getting proper portable water is almost next to impossible, whatever be the level of arrangement. So I think people should carry their own water, maybe water from home, or maybe bottles of water, and they should drink water from a good place or carry their own bottles. The second thing is eat food from a healthy place and eat cooked food rather than raw food. If you have raw food, that will be carrying infections much more than a cooked food. So I think cooked food is always a safety factor. Other thing is, whenever you're going to such crowded places, is obviously when you have to walk so much and all that, it's not a very practical solution to say that you should be wearing masks and all that, but yes, try to avoid people, try to keep people at a distance. If you can wear a mask and move around that place, it will at least protect you from the respiratory tract infections. Also see when you are taking a dip and all that, obviously take a dip well, but see to it that the water and all that is not going, you're not ingesting or drinking the water, is not going through your mouth or nose, because once it goes into your system, and if you take a larger volume, then it might be also a source of infection. So we should try to prevent all these things, and maybe after you have taken a bath, if you can have a good bath or clean your skin and scrub your skin with disinfectants or with a normal soap water also, that should prevent some skin infections which are happening in the people.